Every 66 seconds, another senior in this country is told they have dementia. By the time this video ends, 20 more families will have heard those words. And for some of them, the cause was never their age. It was sitting in their kitchen cabinet, in a bottle they trusted, prescribed by a doctor they trusted, for a condition that had nothing to do with their memory. Maybe you've walked into a room recently and forgotten why you went in there. Maybe you've called a grandchild by the wrong name or lost the thread of a sentence halfway through saying it. And somewhere in the back of your mind, a small voice has started asking the question nobody wants to say out loud. Is this just getting older, or is this something worse? Today I'm going to walk you through 9 medications that, taken regularly, have been linked in research to faster memory decline in people over 60. Some of these are sold without a prescription. Some are sitting in your medicine cabinet right now. And one of them, near the very top of this list, is given to seniors for something that sounds almost too minor to mention. Stay with me through this one, because by the end, you'll know exactly which questions to bring to your own doctor. I'm Dr. Albert. For the last 20 years, I've worked with patients in their 60s, 70s, and 80s, and a good portion of that time has been focused specifically on how aging changes the brain and how the medications we rely on interact with it. I've sat across from husbands who couldn't understand why their wife of 50 years suddenly seemed like a stranger to them, and more than once, the answer wasn't the disease everyone feared. It was something we could actually fix. That's exactly why I made this video. Here's something most people don't realize until it touches their own family. Memory loss is not a single condition with a single cause. It's a symptom. And symptoms can come from more than one direction. After 60, your liver and kidneys process medications more slowly than they used to. A dose that was perfectly fine at 45 can sit in your system longer at 70, building up in ways your prescribing doctor may not have flagged, especially if you see more than one physician and nobody is looking at the full list together. Research from major geriatric health organizations has repeatedly pointed to certain drug categories as carrying a disproportionate risk for cognitive decline in older adults, to the point that medical groups maintain formal lists of medications considered risky for seniors specifically because of this. This matters because memory isn't just about remembering a name at a dinner party. It's about whether you can live independently, whether you can manage your own finances, whether you can drive to see your grandchildren without getting confused on a road you've taken for 30 years. That is what's actually at stake here, and that is why this list deserves 5 minutes of your full attention. To understand why certain medications hit the aging brain so hard, you need to understand one chemical, acetylcholine. Think of acetylcholine as the brain's internal mail carrier. Every time you learn something new, form a memory, or stay sharp and alert through a conversation, that mail carrier is running messages between brain cells, delivering the information that lets one thought connect to the next. As we get older, the brain naturally produces less of this chemical, so it's already running a smaller mail crew than it used to. Now, imagine a medication comes along and blocks that mail carrier from doing its job. Messages stop getting delivered. New memories don't get filed properly. That's what doctors call an anticholinergic effect. And a long list of common medications, not just psychiatric drugs, carry this property to varying degrees. Some block it gently, some block it hard, and several others on this list damage memory through entirely different pathways, from disrupting sleep architecture to depleting nutrients your brain depends on. I'll explain each mechanism as we go, in plain language, so you understand exactly what's happening inside your own body. Let's start at number 9, and don't assume the bottom of this list is the least important, because this one is sitting in nearly every household in America. Number 9 is diphenhydramine, the active ingredient in Benadryl and in most PM nighttime products. It's sold without a prescription, it's inexpensive, and that combination convinces people it must be harmless. It is one of the strongest anticholinergic medications available, and when taken nightly for sleep over months or years, research has linked regular, long-term use to a meaningfully higher risk of cognitive decline in older adults. If you reach for anything labeled nighttime, PM, or allergy relief most nights of the week, check the active ingredient tonight. A newer generation antihistamine, like loratadine, doesn't cross into the brain the same way and is generally considered far gentler for long-term use. Never stop a sleep aid abruptly on your own. Bring this to your doctor first. Number 8 is something almost nobody connects to memory at all. Long-term proton pump inhibitors, the heartburn medications sold as omeprazole or esomeprazole. These drugs shut down stomach acid, and your body actually needs that acid to absorb vitamin B12 properly. B12 is essential for nerve and brain function, and low levels over years can produce confusion and memory problems that look remarkably similar to early dementia, when the real issue is a nutrient deficiency the medication quietly caused. If you've taken one of these every day for years, ask your doctor whether your B12 has ever been checked and whether you could step down to the lowest effective dose. Number 7 is for a problem people rarely discuss out loud: bladder control medications, particularly oxybutynin. It's prescribed constantly for overactive bladder, and it works by blocking that same acetylcholine messenger we talked about earlier, except this one crosses into the brain especially easily. People taking it often describe a slow mental fog that creeps in over months, and it gets blamed on age almost every time. If this is you, ask your doctor about mirabegron, a newer bladder medication that works through a different pathway entirely and doesn't carry the same memory risk. The next one surprises a lot of people because it has nothing to do with the brain on the surface. Number 6 is muscle relaxants, particularly cyclobenzaprine, often prescribed after a back strain or muscle spasm. These drugs are heavily sedating, and in an older adult, that sedation doesn't just make you sleepy. It can blunt alertness and short-term recall for as long as the drug stays active in your system, which is often longer than people expect at this age. If you've been on one of these for more than a week or two, that's worth revisiting with your doctor, since most muscle injuries don't require a sedating medication for that long. Now let's address something I see constantly in my own patients: opioid pain medications, including hydrocodone and tramadol, prescribed after surgery or for chronic pain. These medications can be genuinely necessary, and this isn't a case against using them when appropriate. But they slow the entire central nervous system down, and in someone over 65, that often shows up as confusion, slowed thinking, and memory gaps that family members notice before the patient does. If pain management has had you on these for an extended stretch, ask whether a non-opioid approach, physical therapy, or a lower dose could accomplish the same relief with less cognitive cost. If this is helping you connect a few dots about your own medicine cabinet, take a moment to subscribe to this channel. My goal with every video is to help you walk into your next doctor's appointment with better questions, so you can protect your independence for as long as possible. Number 4 belongs to one of the oldest classes of antidepressants still in regular use: amitriptyline. It's prescribed today for nerve pain, migraines, and sleep, often in small doses that seem too low to cause concern. But amitriptyline is one of the most strongly anticholinergic medications still on the market, and research following older adults over many years has linked higher cumulative exposure to a meaningfully greater risk of dementia. If you take this for pain or sleep, ask your doctor about duloxetine or gabapentin for nerve pain, or a different approach for sleep, since gentler options exist. Number 3 is one I want you to pay close attention to: benzodiazepines, including lorazepam, diazepam, and alprazolam, commonly prescribed for anxiety and sleep. These work by calming the nervous system, and the relief can feel immediate and real. Over the longer term, research has associated regular use with a higher risk of cognitive decline in older adults, and the effect appears to build the longer someone stays on them. Here's the critical safety point: never stop a benzodiazepine suddenly. Stopping abruptly can cause severe withdrawal, including dangerous anxiety and even seizures in some cases. If you've been on one for more than a few weeks, work with your doctor on a slow, supervised taper and ask about non-sedating alternatives for anxiety, including certain therapies that have been shown to work as well as medication for sleep problems, without the cognitive cost. Number 2 concerns me more than almost anything else on this list, because many people taking it don't even know what category of drug they're on. Antipsychotic medications, including quetiapine and risperidone. These were developed for serious psychiatric conditions, but they're frequently prescribed off-label to older adults simply to manage restlessness or sleep difficulty, sometimes in nursing facilities, sometimes at home. Research has linked their use in older adults, particularly those with existing memory concerns, to faster cognitive decline and increased risk of serious cardiovascular events. If you or a family member has been started on one of these for sleep or agitation, the question to ask your doctor directly is simple. Why was this specific medication chosen, and is there a non-drug approach we haven't tried yet? Which brings us to number 1, and it isn't a single medication at all. It's what happens when several of the medications on this list are taken together. Picture 3 separate drugs, each with a mild anticholinergic effect on its own, almost too small to notice individually. Combined, day after day, their effects don't just add up, they compound, the same way 3 small leaks in a roof can eventually flood a room that any one leak alone never would have touched. Research tracking large groups of older adults has found that people carrying the highest combined anticholinergic burden across multiple medications face a substantially higher risk of dementia than people on any single one of these drugs alone. And the part that troubles me most is that almost nobody calculates this total burden, because each prescription was written by a different doctor treating a different problem, with nobody looking at the whole picture at once. I want to tell you about a patient I'll call Robert, a retired electrician who came to see me with his daughter at his side. He was 74, sharp his entire working life, the kind of man who used to fix everything in the neighborhood from memory alone. Over about a year, his daughter noticed he was repeating questions, losing his train of thought mid-sentence, and once, frighteningly, forgetting how to get back to his own street after a familiar drive. The family had already begun preparing themselves for an Alzheimer's diagnosis. When we sat down and went through his medications together, line by line, a pattern emerged. He was taking a nightly antihistamine for sleep, a bladder medication, and a muscle relaxant left over from an old back injury. 3 separate prescriptions, written by 3 separate doctors, none of whom had seen the full list together. We worked with his physicians to taper off the heaviest offenders and replace them with gentler alternatives. Within about 10 weeks, his daughter called to tell me he'd remembered her birthday without being reminded, something that hadn't happened in over a year. I want to be honest with you. Not every story ends this clearly, and not every memory problem is medication-related. But for Robert, the brain wasn't failing. It had simply been buried under a chemical weight nobody had added up. So here is what I want you to actually do, starting tonight. First, make a complete list of everything you take, every prescription, every over-the-counter pill, every supplement, and bring that full list to one appointment, not scattered across several doctors. Second, ask specifically whether any of your current medications carry anticholinergic or sedating effects, and whether your pharmacist can calculate your total cumulative burden. Third, never stop a medication abruptly on your own, particularly benzodiazepines, antidepressants, or anything affecting sleep or anxiety. Sudden discontinuation can be genuinely dangerous and must be managed by your doctor. Fourth, pay attention to timing. If memory changes, confusion, or unusual tiredness began shortly after starting a new medication, write down the date and mention it specifically, since that timeline is often the clue that gets missed. And finally, if you notice sudden, severe confusion, difficulty speaking, or disorientation that comes on quickly, that warrants urgent medical attention, not a wait-and-see approach. Your memory isn't just a medical detail. It's the thread that holds together every relationship in your life, every grandchild's name, every story worth telling twice, every bit of independence you've worked your whole life to keep. Some of what threatens that thread truly is beyond our control, but some of it, as we've seen today, is sitting quietly in a cabinet, waiting for someone to finally ask the right question. I'd like to know, did any of these 9 surprise you, or are you already taking one of them? Tell me in the comments and tell me whether you plan to bring this list to your next appointment. If someone you love has been blaming their memory on just getting older, send them this video tonight. That single share might be the conversation that changes everything for them. If you found this valuable, subscribe to this channel, because next time I want to show you the warning signs your hands can reveal about your kidneys and your nervous system, often years before anything else shows up. I'm Dr. Albert. Take care of that mind of yours, and I'll see you in the next one.